Multiple choice questions, MCQs. Sensory assessment of vision, tactile, vestibular systems and techniques of sensory stimulation and integration. Sensory assessment and stimulation, vision, tactile, vestibular systems. 1. What does visual sensory assessment primarily evaluate? A. Auditory memory. B. Light perception and tracking. C. Taste sensitivity. D. Speech production. Answer. B. 2. Which tool is commonly used to assess visual acuity in young children? A. Snellen chart. B. Ishihara plates. C. Leah symbols chart. D. Audiometer. Answer. C. 3. Tactile sensory assessment evaluates a person's ability to A. Recognize sounds. B. Identify tastes. C. Detect touch and textures. D. Balance on one foot. Answer. C. 4. Vestibular assessment focuses on evaluating A. Vision in dim light. B. Response to pain. C. Sense of balance and spatial orientation. D. Fine motor coordination. Answer. C. 5. Which test is used to evaluate vestibular function? A. Finger-to-nose test. B. Romberg test. C. Snellen chart. D. Visual field test. Answer. B. 6. A child who frequently bumps into objects may have difficulty with A. Tactile processing. B. Visual acuity. C. Vestibular or proprioceptive function. D. Language skills. Answer. C. 7. Which of the following is a tactile defensiveness indicator? A. Enjoys messy play. B. Avoids certain textures. C. Seeks bright lights. D. Ignores loud noises. Answer. B. 8. What does proprioception refer to? A. Awareness of smell. B. Awareness of body position and movement. C. Visual interpretation. D. Language decoding. Answer. B. 9. Which equipment helps in vestibular stimulation? A. Swing. B. Flashlight. C. Sandpaper. D. Sound recorder. Answer. A. 10. Which of these is not a visual assessment technique? A. Visual tracking. B. Contrast sensitivity. C. Pressure sensitivity. D. Visual field mapping. Answer. C. 11. Sensory integration therapy was developed by A. Jean Piaget. B. Anna Jean Iris. C. Erik Erikson. D. B. F. Skinner. Answer. B. 12. What is used for assessing tactile discrimination? A. Tuning fork. B. 2-point discriminator. C. Thermometer. D. Hearing aid. Answer. B. 13. Which therapy tool is used for sensory integration in the tactile domain? A. Trampoline. B. Swing. C. Sensory bin with rice or beans. D. Flashlight. Answer. C. 14. A child with poor vestibular processing might show A. Excessive spinning or avoiding movement. B. Strong visual focus. C. Increased appetite. D. Overuse of hands. Answer. A. 15. What is the goal of sensory stimulation techniques? A. Improve academic scores. B. Regulate and enhance sensory processing. C. Cure visual impairments. D. Increase motor strength. Answer. B. 16. Which system provides input about gravity and head movement? A. Auditory. B. Olfactory. C. Vestibular. D. Tactile. Answer. C. 17. Tactile sensitivity can be assessed using A. Vibrating tools. B. Light touch and pressure. C. Visual tracking. D. Sound localization. Answer. B. 18. Children who are hyposensitive to touch might A. Avoid being touched. B. Seek excessive touch or pressure. C. React aggressively. D. Cry with gentle brushing. Answer. B. 19. Visual motor integration involves A. Auditory processing and body movement. B. Coordination between eyes and hands. C. Speech and language development. D. Tactile sense and vestibular function. Answer. B. 20. What kind of sensory activity helps improve visual tracking? A. Spinning in a chair. B. Following a moving object with eyes. C. Identifying smells. D. Sorting textured fabrics. Answer B. 21. Which of the following helps with vestibular input? A. Bean bags. B. Rocking horse. C. Puzzles. D. Shape sorter. Answer B. 22. A child who dislikes tags on clothing may have A. Auditory defensiveness. B. Tactile defensiveness. C. Visual impairment. D. Proprioceptive dysfunction. Answer B. 23. What sensory tool enhances proprioceptive input? A. Weighted blanket. B. Color chart. C. Light box. D. Talking calculator. Answer A. 24. A child who avoids climbing, jumping or fast movement may have A. Poor vision. B. Tactile aversion. C. Vestibular hypersensitivity. D. Good proprioception. Answer C. 25. Which of the following is a vestibular calming activity? A. Fast spinning. B. Jumping. C. Slow linear swinging. D. Vibrating pad. Answer C. 26. Which technique helps improve tactile discrimination? A. Jumping on trampoline. B. 2-point discrimination tasks. C. Flashing lights. D. Listening to music. Answer B. 27. Which sense allows children to explore object features such as shape and texture? A. Visual. B. Tactile. C. Auditory. D. Olfactory. Answer B. 28. What is the primary role of the vestibular system in learning? A. Enhancing taste sensitivity. B. Supporting balance and coordination. C. Increasing touch response. D. Improving auditory processing. Answer B. 29. Which item can be used for both tactile and proprioceptive stimulation? A. Chewable jewelry. B. Weighted vest. C. Textured therapy ball. D. Flashlight. Answer C. 30. Which activity enhances proprioceptive input and body awareness? A. Scent discrimination. B. Deep pressure activities like pushing heavy boxes. C. Watching moving images. D. Listening to calming music. Answer B. 31. What is a common indicator of sensory processing disorder in children? A. Average IQ. B. Preference for sweet food. C. Over-under responsiveness to sensory input. D. Strong verbal skills. Answer C. 32. Which of these is a sign of under-responsive vestibular system? A. Constant spinning or swinging. B. Avoiding physical play. C. Covering ears often. D. Seeking tactile toys. Answer A. 33. Which method is used to assess eye coordination and alignment? A. Binocular vision testing. B. Thermometer reading. C. Whisper test. D. Smell test. Answer A. 34. What is the goal of a sensory diet in therapy? A. Reduce body fat. B. Plan structured sensory activities. C. Improve speech clarity. D. Teach numeracy skills. Answer B. 35. Which sense is mostly engaged while walking on uneven surfaces? A. Visual. B. Proprioceptive. C. Vestibular. D. Tactile. Answer C. 36. What kind of activity can alert a child who is under-responsive to tactile input? A. Light touch with feather. B. Soft massage. C. Brushing skin with varied textures. D. Slow swinging. Answer C. 37. What is the most suitable sensory integration tool for vestibular input? A. Rocking chair. B. Coloring book. C. Music player. D. Picture cards. Answer A. 38. Which activity involves both tactile and visual systems? A. Listening to stories. B. Drawing in sand. C. Balancing on beam. D. Deep pressure hugs. Answer B. 39. Why is early sensory assessment important? A. To delay motor skills. B. To label children.